Hello, my name is Dr. Jonathan Lazare. The show is called Health, Medicine, and Sex. On this show, we're going to be discussing all aspects of men's health, and we're going to be discussing sexual issues concerning men and women. I am a urologist. I work in Brooklyn at the New York Methodist Hospital, and I work in Manhattan at the Mount Sinai Medical Center. I welcome you. Please feel free to email me any of your questions to jnlmd3, and I will do my best to either answer the questions on the air or to reply to you via email. Okay, so again, I am a urologist. What exactly gives me the right to talk about men's health? Well, you could argue that the urologist is the expert on men's health. So what exactly is a urologist? A urologist is a surgical subspecialist that specializes in disorders of the kidneys and the bladder in men and in women. So we perform surgery on the kidneys and the bladder of both men and women. We also treat disorders of the male prostate, testis, and penis. So what does it take to become a urologist? It takes 4 years of college, 4 years of medical school, and 5 years of residency training. So it takes a minimum of 13 years of training after high school to become a urologist. And I say a minimum because some of us, after finishing all that training, go on to do additional fellowship training in a specialized area of urology. So I'm telling you this not so much to brag, but to give you an idea as to who the experts are in men's health. Today you find a number of fake experts, especially on the internet. There are a lot of websites that are trying to sell you products or medications or treatments that are backed by a so-called expert. But this expert is not really an expert. And so I gave you an idea of what my background and what my training is so that you can judge who the experts really are. Now, what is my approach? What is my philosophy? What is my bias? You could summarize this all in one word: science. Today's medicine is scientific. The art of medicine is dead. Dead. And I say, good riddance. Why? Because medicine based upon science is way more successful. The average life expectancy in this country is close to 80 years of age. It's actually between 78 and 79. Women live an average of 5 years longer than men. 100 years ago, the average life expectancy was almost half, or about 45 years of age. The increase in life expectancy is due to a lot of different things: better nutrition, better sanitation, but modern medicine has played a major role in this increase in life expectancy. Now, modern scientific medicine does not mean medicine without compassion. The two have nothing to do with each other. We all have the image growing up of the old-fashioned general practitioner, the Marcus Welby type, who used to go make house calls carrying his little black bag. Well, I don't think today an MRI scanner or a CT scanner would fit into one of those bags. Today's medicine is high tech. And the best doctors are medical scientists. And they will make you live longer, and they will make you live healthier. And they're very good at what they do. Now, in order for me to recommend a treatment or a medication, it has to be based upon science, which means it has to be based upon a good study. Now, what exactly is a good medical study? Well, for example, you take a group of men with a medical condition. Half of the men receive a treatment and the other half do not. You have to show that the men who receive the treatment do better than those who do not receive the treatment. This is a good study. And where does such a study get published? Two excellent journals are the Journal of the American Medical Association, or JAMA for short, or the New England Journal of Medicine. If a study gets published in either of these two journals, you can be pretty sure that it's a decent study. In addition, every medical specialty has their own journal. My specialty journal is called the Journal of Urology. If there's a study pertaining to urology that gets published in the Journal of Urology, you can be sure that it's of good quality, that it's a good study. During my first show, I have tried to give you an idea as to what a urologist is and what the credentials are of someone who's an expert on men's health. Hopefully that'll enable you to judge who the experts are and who you should listen to. So the next time you walk into your vitamin store, go up to the manager of the store and say, "Excuse me, sir, is there any scientific study published in a reputable journal that actually shows that your vitamin pills work?" He'll probably turn red and ask you to leave the store. Similarly, the next time you visit your website trying to sell you a medical product, email the website and say, "Could you show me a study that shows your product works?" You'll probably get the same response. And finally, the next time you go to your organic grocery store, go up to the store manager and say, "Excuse me, sir, is there any evidence or study that shows that organic food actually makes people live longer or live healthier?" The owner of Trader Joe's is a Russian billionaire. And my question is there any scientific evidence whatsoever to justify his trillion-dollar organic food empire? Is there any evidence that shows that organic food makes people live longer or healthier? Food for thought. Anyway, that concludes my first show. On the next show, we're going to start to learn about the male erection. If you have any questions, please email me at jnlmd3. Thank you very much.